Okay, anyway, so what are some healthcare myths and misconceptions? There's so many out there. Here with more is Quincy Branch and Todd Mays. You've seen them here before, and these guys are really good at really giving the detail about all of the healthcare business going on in our country. Gentlemen, Happy New Year. Thank you for being here. Thanks for coming back. Okay, let's get right down to it because I know a lot of folks are trying to sign up again, trying to get into the system. The first myth that we want to talk about, well, let's first of all talk about BBC. Tell us about your company.
Okay. Well, we're local insurance brokers that we don't specialize only in healthcare. We do other lines as well. But right now, Monica, the biggest thing that we're finding, you remember that old school game of telephone?
Yes.
Where you had to whisper? That's what we're finding right now. Like one person comes on TV, says something, and someone tweets about that.
Right.
Then someone tweets about what they read on Facebook. And before you know it, what the original person said, it's totally
gone.
Misconstrued.
Yes.
So we're running into a lot of people that are just really misinformed consumers.
Okay.
So we're just trying to make sure that people are just informed consumers, and that's why we're here today talking about those 5 myths.
Okay, let's get right down to it. So the first myth, Obamacare is not the same as Affordable Care Act.
You would be surprised how many people believe that they are two separate things. And
really?
It's amazing. But just to debunk that myth, Obamacare, the Affordable Care Act, healthcare reform, PPACA, however you want to slice it, they're all the same thing.
It's one and the same.
One and the same.
Yes.
And I've had people literally tell me that, oh, I would never sign up for that Obamacare, but I'm interested in the Affordable Care Act.
Oh boy.
So again, we have to be informed consumers.
Yeah, that's a little scary too. Okay, myth number 2, the Affordable Care Act is free insurance.
It's not technically free, unfortunately. Right. People are eligible for subsidies. They're able to get subsidies through the government, but it's not technically free insurance. Their subsidies are based on their income.
Okay.
And we actually help walk them through that. And that's why it's important that they actually meet with an insurance professional to assess what subsidy they're actually eligible for.
All right. Now, myth number 3, the only place to get individual health insurance is through the exchange.
Right. So you're seeing all the commercials and the ads saying everyone go to healthcare.gov, healthcare.gov.
Yeah.
And of course, you can go there for people that are eligible for the subsidy. But people that are not eligible can still get insurance off the exchange, and they're exact same government mandated plans.
Okay. All right. And myth number 4, the individual mandate and penalty applies to everyone. What does that mean?
And it does not, actually. There are folks that are not subject to the penalty or to the mandate. Anyone over 65 who's Medicare eligible. But there's also other people who are basically not covered by the mandate. If you are of Native American descent, things of that nature. So it's good to consult your insurance professional again to find out whether you are covered by that or not. I mean, you may not need to get that coverage.
Okay.
So, Monica, if you don't mind.
Yeah, go right ahead, Quincy.
It's tax season. So a lot of people are coming around, and now that question is in the tax form software.
Okay.
So they're asking you, have you had insurance? So again, that's going to spark the debate, and again, people need to be aware when you're going to get your taxes filed to know that you have insurance.
To know that. Okay, guys, we're out of time. Give me this last one real quick. Myth number 5, I don't need an insurance professional to assist me.
Myth, completely. Because again, you're dealing with a myriad of plans, and again, you want to make sure that you get the right plan, the right price that fits your medical needs.
Right,
so again,
exactly.
Our services are free. Why not call us?
All right, and folks, there is the information, because I don't know about you, but I was confused even when they explained it to me. The number there's on your screen. You can contact the guys there, and please, I hope you guys get some help, because I know it can be very confusing, especially with tax season coming, right?
Absolutely.
Okay, guys, thank you so much. Good to see you again.
Good to see you again.
All right, guys, over to you.